Today, we are going to look at a BodyViz brain builder about tissue types and go through a case study example of skin repair. The human body consists of 4 primary types of tissues: epithelial, connective, muscle, and nervous tissues. A tissue is a group of cells that collaborate to achieve a common function. Epithelial tissues are classified based on the number of cell layers they have and the shapes of the cells themselves. The primary cell shapes are squamous, cuboidal, and columnar, and the cell layer classifications are simple, stratified, pseudostratified, and transitional. Simple epithelium, a single layer of cells. Simple squamous cells. These are flat and fit together like puzzle pieces. Simple cuboidal cells. These are cube-shaped and are roughly as wide as they are tall. Simple columnar cells. These are elongated. They are taller than they are wide. Stratified epithelium. Multiple layers of cells. Stratified squamous. Multiple flat layers of cells, found in areas that face a lot of abrasion, like the skin of the mouth and esophagus. Stratified cuboidal. 2 layers of cube-shaped cells, found in some sweat and mammary glands. Stratified columnar. Less common, but can be found in parts of the male urethra and some glands. Pseudostratified epithelium. Appears to be multiple layers due to nuclei being at different levels, but it's just 1 layer. Pseudostratified columnar. Often ciliated and found in the respiratory tract, aiding in moving mucus. Transitional epithelium, specialized for stretching and can be found in the bladder, ureters, and urethra. Epithelial tissues perform several important functions. These include covering and protecting, secretion, filtering, excretion, diffusion, touch reception. When injured, epithelial cells quickly initiate repair processes, aiding in wound healing and tissue restoration. Connective tissues, varied in composition, are widespread throughout the body. They support and cushion organs and cells, transport blood, gases, and nutrients, defend against invaders, and aid in tissue repair. These tissues have a non-living matrix, also known as ground substance, where cells are embedded. This matrix can range from liquid to hard and includes protein fibers. Blood supply to connective tissues can vary, which affects regeneration. For example, bone has a good blood supply, while cartilage has none. Proper connective tissue. Loose connective tissue includes areolar tissue, binds organs, and provides flexibility. Dense, regular connective tissue, found in tendons, ligaments, and aponeuroses, with densely packed fibers for connection and stabilization. Dense, irregular connective tissue, found in the dermis, sclera, periosteum, and outer testes lining, protecting organs and resisting tearing. Specialized connective tissue, adipose tissue, fat storage, bone tissue, hard matrix with embedded cells, blood, living cells in plasma. Muscles create movement, support the body, circulate blood, and generate heat. Muscle tissue functions include excitability, extensibility, elasticity, and contractility. Types of muscle tissues are skeletal muscle, striated, voluntary, associated with bones; smooth muscle, non-striated, involuntary, found in hollow organs; cardiac muscle, striated, involuntary, and located in the heart. Nervous tissue, composed of neurons and neuroglia, forms the brain, spinal cord, and nerves. Neurons transmit electrical signals and consist of a cell body, dendrites, an axon, and synaptic boutons. Nervous tissue coordinates body functions, including muscle contractions and digestion regulation. Minor cuts to epithelial tissues can be treated at home, while deeper wounds may require medical attention involving sutures, staples, adhesive strips, or surgical glue based on the injury's depth and location. Poor blood supply can slow or prevent healing, which can lead to chronic wounds. Certain factors such as age, diabetes, high blood pressure, obesity, and smoking all increase the risk of a wound not healing properly. If a wound isn't healing properly or is showing signs of infection, such as heat, redness, and pus leakage, medical attention is highly advised. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age, 45. Sex, female. Chief complaints, deep laceration on the forearm. You invite the patient into your office for an examination. The patient presents with a deep, straight cut on the forearm, which she sustained from a fall. Immediate treatment begins with controlling the bleeding, mirroring the body's natural hemostasis response. You apply pressure to the wound to halt blood loss, similar to how the body's platelets clump together to form a clot. Applying direct pressure helps start the clotting process. Platelets and fibrin typically create a stable scab, which protects the wound. Next, the wound is cleaned to prevent infection, paralleling the inflammation phase of skin repair. Blood vessels dilate, bringing fresh oxygen and nutrients to the area. Blood vessels also become more permeable, which helps macrophages arrive to fight infection and clear debris. Macrophages will then release growth factors that signal the repair process. Imaging confirms there are no broken bones or urgent underlying damage that needs attention. The wound is then closed with sutures, which aid in the proliferation phase. Blood cells, including the oxygen-rich red blood cells, rush to the wound, and fibroblasts start producing collagen. This collagen forms a scaffold for new tissue which gradually covers the wound. Typically, the new skin forms beneath the protective layer of a scab by working inwards from the undamaged skin surrounding the site of the wound. The remodeling phase begins as the new tissue strengthens. Over weeks, collagen fibers reorganize and the wound gains strength, though it may not ever make a full recovery to its undamaged state. In fact, it may only reach about 80% of its original strength and elasticity and will likely leave a scar. You advise your patient to keep the wound clean and monitor it for signs of infection. You schedule a follow-up to remove sutures. By understanding the phases of skin repair, hemostasis, inflammation, proliferation, and remodeling, the patient can appreciate how both medical intervention and the body's natural processes work together to heal. This has been a classic example of skin repair. Thank you for watching this Brain Builder video. Please like and subscribe to our BodyViz channel, or if you are new at BodyViz, check out our other anatomy resources and schedule a demo at bodyviz.com.